Hi there, QAC TV. We're live, we're in the studio, and as you can see, we're social distancing with me and Mandy in the room. We have Chris and Ted in the booth, and today we are just giving you a little bit of prep before we jump into live coverage of Governor Hogan's press conference, Maryland Strong, a roadmap to recovery. So once he's up and running and he's talking, we're going to cut right to Governor Hogan's press conference. So just stick with us now as we just wait for that to start. And Mandy, what do you think he's going to talk about today?
I don't know. I think a lot of the discussion is going to be, Bruce, the schools. Everybody has a lot of questions about the schools, work. You know, some people are really getting anxious. They want to get back to work. You know, some of the things I think he's going to keep in social distancing. I don't think that's something that's going away. So I think he's going to discuss how he's going to put that into further and beyond through the summer and out.
Sure. And I know he's definitely doing... Oh, he's going live now, so we're going to go over to Governor Hogan. That's fine. So he hasn't started yet? He's frozen. Fair enough. They're having technical issues, not us.
See,
just to be
there we
clear.
go.
So we're back in the studio. We're going to wait for that. Once that unfreezes and they're rolling, we'll get started. So he hasn't started yet? So the roadmap. So we know he's going to probably give future inclination of what's going to happen between that. How's life for you, though?
It's going. Of course, I'm essential. So, you know, we're getting used to the norm. Masks have been our thing for 4 weeks. So, I mean, wash your hands. Wash your hands.
It's all right.
Wash your hands.
Yeah, you have a shirt now, right?
I have a shirt that says wash your hands. I do. It's very important.
So how have you seen the public coming in? Is everyone trying to stay positive? Are people having a hard time?
Everybody is starting to get antsy. But it's interesting because people that have been home for...
Good afternoon.
We're good. Keep going.
You know, it's becoming exhausting on us because we're here trying to inform and take care of the public and the community, and you know, it's interesting to see both sides of the story.
Right. Oh man, I see we keep flipping back. If you're with us, bear with us for a couple minutes. We're waiting for Hogan's press conference. He's tried to start, but he's having some technical issues over there. So they're freezing up. But once it's off and running, we're going to switch over to Governor Hogan's press conference.
There's probably actually a lot of people tuning in.
Yes. Yeah. This is a big one. I anticipate being a big one, and probably a long one. So sit back and get comfortable, because if he's unleashing this whole roadmap to recovery, he's got a lot to talk about. So Mandy, while we're waiting, you actually had some time to shoot some stuff today, right?
Yes, we had fun. I got to do a good old
in
around
our state, and we have not had the very high spikes and length that you have seen in other states. In our state. But that is also why we are several weeks behind those other states who spiked and peaked earlier. The number of new cases of COVID-19 is still rising here in Maryland and throughout the Maryland, D.C., and Virginia region. And by the federal standards instituted last week and under the guidance given in the studies and reopening plans that we cited, Maryland is not yet able to lift our restrictions. We are dramatically increasing the amount of testing here in Maryland, and as a result, we are going to continue to see the number of total cases increasing. So for the purposes of our planning, the key numbers that we are most focused on are the rate of hospitalizations and the numbers of patients being admitted to ICU. We are watching these numbers very closely on a daily basis. And when we start to see that downward trajectory or a consistent plateauing of those metrics, that can put us in a position to consider lifting the stay-at-home order and beginning our gradual, safe, and effective recovery plan. As I discussed on Wednesday, we have made considerable progress on all 4 of the building blocks which needed to be firmly in place before we could consider lifting restrictions. First, we have exponentially expanded our testing capability. Second, we are exceeding our goals to increase hospital surge capacity. Third, we are making progress in increasing the supply of PPE. And fourth, we have quadrupled our capability to do contact tracing by building a robust force of 1,000 contact tracers and launching a state-of-the-art contact tracing platform called COVID Link. Having these 4 building blocks or pillars in place gives us the public health infrastructure to try to attack this virus from every direction. And this has allowed us to be in the best position possible to begin our reopening and recovery just as soon as we reach the necessary trends in the critical metrics. I'm optimistic that if Marylanders continue staying home and continue practicing physical distancing a little while longer, that our numbers could continue to plateau. And I'm hopeful that we could then be able to begin our recovery in early May. Our Maryland Strong roadmap to recovery has 3 stages. Stage 1 would begin by lifting the stay-at-home order, and it would include the reopening of many of our small businesses. We would be able to restart many of our lower-risk community activities and quality of life improvements. Changes that could occur during our first stage would include the reopening of certain businesses and retail shops, the reopening of golf courses and recreational boating and fishing, tennis, outdoor religious activities, along with outdoor fitness and gym classes, and the resumption of elective outpatient surgeries and procedures in certain counties with lower concentration of cases. Local governments could also have additional flexibility to open things including local parks and playgrounds, municipal recreation centers, and libraries if they deemed that appropriate safety protocols could be followed. These decisions would be based on the ability to continue physical distancing and to continue to limit person-to-person contact. If stage 1 activities resume successfully without a spike in deaths, a sustained spike in ICU cases, or significant unforeseen outbreaks of community transmission, we would then be in a position to move into stage 2, where a larger number of businesses would open, non-essential workers who cannot telework could return to work, and other public activities would be able to come back online. Indoor religious gatherings could resume with perhaps limited capacity and physical distancing measures. It would include raising the limits on the number of people in social gatherings, perhaps the returning to a more normal public transit schedules, and the opening of restaurants and potentially bars with significant safety restrictions. And then the third and final stage would be reinstituting higher risk activities such as larger social gatherings, events, religious gatherings and activities at entertainment venues, and a further lessening of restrictions at hospitals, and eventually nursing homes. I want to stress that each of these recovery stages will need to be instituted in a safe, gradual, and effective manner. If we try to rush this, and if we don't do it in a thoughtful and responsible way, it could cause a rebound of the virus, which could deepen the economic crisis, prolong the fiscal problems, and slow our economic recovery. Look, I'm a lifelong small businessman, and the entire focus of my administration has been growing the private sector, creating jobs, and turning our economy around. It's the reason I ran for governor, and it breaks my heart to see so many Marylanders struggling and going through so much economic pain. So let me be very, very clear. Other than keeping Marylanders safe, saving lives and defeating this hidden enemy, there is absolutely nothing more important to me than getting people back to work, getting our small businesses reopened, and getting our economy back on track. And I want to assure you that we are going to do everything we possibly can to do that just as quickly as we possibly can in a safe way. In the days and weeks ahead, we will continue to be open and transparent. We will continue to keep Marylanders as fully informed on the facts as we possibly can. Since day one of this crisis, we've been making our decisions based on the best advice of an incredible coronavirus response team, which includes some of the smartest scientists and public health experts in the world. And as we move into this recovery phase, we're going to continue to rely on their advice and also on the advice of some additional business and economic leaders. Our coronavirus response team has now transitioned into a coronavirus recovery team with some additional distinguished leaders who have joined this effort, including my partner in government, Lieutenant Governor Boyd Rutherford, who has been a major part of all of our efforts, Arnie Sorensen, the president and CEO of Marriott International, who is the co-chair of the COVID-19 task force of the Business Roundtable, Robert Doerr, the leading economist and the president of AEI, the American Enterprise Institute, Kevin Plank, the executive chairman of Under Armour and a trustee of the University of Maryland Foundation, Jim Davis, the chairman and co-founder of Allegis Group, the largest staffing firm in the United States, Mark McManus, who is the general president of the UA, the United Association, which represents 355,000 members of the building trades in local unions all across North America, and Augie Chisera, who's the president of M&T Bank's Baltimore and Chesapeake regions, and a board member of the Economic Alliance of Greater Baltimore. The coronavirus recovery team will be advising us and helping guide our real-time decisions on Maryland's recovery and reopening process. We have also assembled 15 industry-specific advisory groups, which will be coordinated by our Department of Commerce and the Governor's Office of Community Initiatives. Leaders from key industry sectors, including small businesses, retail, restaurants, financial services, construction, manufacturing, and many more, as well as representatives from churches, faith-based organizations, service organizations, and nonprofits, are developing plans with proposed recommendations and guidelines determining how their industries can reopen in a way that can keep their employees, their customers, and the public safe. I want to stress that even as we begin our recovery, we won't be able to just flip a switch. Unfortunately, life is not going to just immediately go back to normal. In fact, it is important to recognize that until a vaccine is developed, the way we go about our daily lives and the way we work is going to be significantly different for a while longer. But as we begin to reopen, it will continue to be important for Marylanders, particularly older and more vulnerable Marylanders, to continue to stay home as much as they can. And all Marylanders should continue to avoid crowds and gatherings, and they should continue to practice physical distancing and to take precautions to protect themselves, their families, and their fellow Marylanders. The full details of our Maryland Strong Roadmap to Recovery, the federal guidelines, the NGA plan, as well as the AEI and Hopkins reports are all available at governor.maryland.gov/recovery. Together, we are going to defeat this deadly virus, and together, the state of Maryland will return stronger and better than ever. And now I'm going to turn the mic over to Dr. Tom Inglesby, who is going to discuss our current health situation here in Maryland and talk about where we currently are in the curve and what we should be looking for in order to begin stage one of our recovery process.
Thank you, Governor Hogan. It's good to be with you and your team here, and I wanted to start by offering my words of support for the direction you are leading the state here. We all want the state to reopen as quickly as it can, but it's clear that if we open the state today, we would risk a fast acceleration in the epidemic to very high numbers. The early social distancing measures put in place by the governor and his team stopped the rapid rise in cases and have flattened the curve in Maryland. New daily cases in the last 2 weeks have been plateauing. If we hadn't put social distancing measures in place the way they have been instituted, the numbers in this state would still have been going up rapidly, perhaps doubling every 5 to 6 days, as they have in many places in the world. At this point, for the state to move forward in easing social distancing in a lower risk way, there needs to be a period of declining hospitalization and ICU stays and deaths from COVID in Maryland. There isn't a decline yet, and we need to keep going to get to a point where the numbers are starting to move downward. As we wait for that decline to happen, we also need to be moving as quickly as possible to ensure 3 other important conditions are in place in the state. We need to have widely available diagnostic testing, and the arrival of 500,000 tests in Maryland this week, in addition to the other testing efforts that are underway, has changed that situation dramatically for the better. We need to have enough masks, gowns, and gloves for our healthcare workers and others in critical positions that are high risk, and that is something that the state and hospitals are fighting for all the time. There's a lot of work going on around that. And we also need to have built strong capacity to isolate cases, trace contacts, and have them get into quarantine. It's really great news to hear that the state has been able to hire a substantial workforce to do that work so it can start to make rapid progress to break the chains of transmission of COVID in our state. When reopening does happen, it will be important for people to understand the settings and work that are lower risk versus more high risk. Outdoors will be safer than indoors. Less social interactions will be better than more social interactions. And closer contact and high density will be higher risk than low density. Workplaces can take mitigation measures to lower their own risks, and they should be planning on those now so they can lower the risks as best they can when their businesses begin to reopen. Unfortunately, this virus is going to be in our state and our country until we have a vaccine and our population gets immunity. So even when the state does begin to reopen, it will be critical for the public to know that its own individual efforts will still be very important. Taken together, all of our collective actions and decisions will either slow this virus down or they will speed up the spread. So we're going to need to keep wearing cloth masks in public. We're going to need to keep our physical space of 6 feet or more. And we're going to need to telecommute when we can and it doesn't disrupt business operations. All of these things will make a big difference when we add them together collectively. So in closing, I want to just say again that the plan that the governor is laying out today is the right path for the state. And I think it's important now to focus hard on getting the plan and programs in place to lower the risks of reopening when that can begin. Thanks very much.
Now I'm going to ask our Secretary of Commerce, Kelly Schultz, to talk about the plans with businesses. Thank you, Kelly.
Thank you very much, Governor. Thank you for the roadmap that you have laid out today. The team at the Department of Commerce continues to work furiously to assist our small businesses through our emergency grant and loan funds. We had to ramp up incredibly quickly and effectively, build these new programs on the fly, but we are getting that money out to our small businesses in need. And so far, we have identified roughly $25 million worth of eligible applications within our grant program alone. But that's not enough, and we'll continue to do more. We have also received over 230 applications for our emergency manufacturing incentive to support Maryland companies who can produce PPE. We're working quickly to process those applications so we can get grants to those great companies. Thus far, we have 15 grants that have been approved for manufacturing innovation. While we have been taking those immediate steps, we have also been looking ahead towards recovery and reopening. For the past few weeks, our business development team at the Department of Commerce has been working closely with our partners in the business community to form 13 industry recovery advisory groups. These will allow stakeholders in these industries to provide insight into the most efficient approach to restarting operations while at the same time protecting the health of their employees and of all Marylanders. As the governor has said, we will not be able to just flip a switch and go back to business as usual. We should all expect there to be new safety considerations as we resume our daily lives. Every industry has unique challenges and may need unique solutions to ensure a clean and healthy workplace. Our advisory groups are composed of stakeholders from key industry sectors that have been particularly impacted by the pandemic and by the difficult choices we had to make to reduce the spread of COVID-19. Tourism, to just name one, was hard hit in everything from attractions to casinos to accommodations, to those places where people come together, such as restaurants and performance venues. That advisory group was the first one we formed and brings together a variety of tourism and tourism-related industry organizations, business leaders, and partner organizations from throughout Maryland. They'll be identifying the critical steps that will need to be taken to get our tourism businesses up and running again, such as working with local health officials to possibly get approval occupancies, rehiring the local workforce, or learning how and wondering when to start restocking the goods and relaunching the services that they are performing. We have also convened specialized panels within the tourism industry for restaurants and bars, accommodations, retailers, attractions, tourism transportation, destination, and sports. The Manufacturing Industry Advisory Group will ensure that industry has a seat at the table for discussions about the steps we'll take when we're ready to start opening up again. We'll be identifying the critical information that will need to be considered to get our businesses up and running, such as making sure all manufacturers can open. We know some right now are open and some are not. And considering a push to buy local and encouraging businesses and consumers to purchase from Maryland-based manufacturers. We also know that the price of some raw materials is now at a premium, which poses yet another great challenge for this industry. After launching the tourism and manufacturing panels, we expanded our scope over the past weeks. We now have an advisory group for construction and development, one for professional and financial services, and one focused on small businesses, which includes personal one-on-one services and the neighborhood mom and pop shops all across Maryland. Our advisory groups represent Marylanders from across the state and from across all walks of life. Each group is compiling recommendations and best practices for how they can operate safely and make sure they are protecting their employees and their customers. I also want to note that we have convened a Maryland Arts Recovery Advisory Group, which is a collaboration between the Maryland State Arts Council, the Fine Arts Office of the Maryland State Department of Education, Maryland Citizens for the Arts, and the Arts Education in Maryland Schools. They are developing a plan for the future of the arts in Maryland, including recommendations for virtual engagement, best practices for in-person engagement, designing a reopening marketing campaign, and strengthening arts advocacy messaging. Maryland will rebound from this pandemic, but it will require collaboration and teamwork. There will be open lines of communication between the government and the private sector, and we will work hand in hand with our business community as we continue down this path of recovery. Thank you.
Thank you, Kelly, and thank you, Dr. Inglesby. Kelly mentioned 13 task forces. I said 15. Steve McAdams, who's the director of the Governor's Office of Community Initiatives, has 2 different additional task forces, not business related, that are with the faith-based and churches, places of worship, and nonprofit groups that he's also convening and getting their input. But thank you all. With that, be happy to take a
Your plan mentions allowing some local jurisdictions some more flexibility. Do you anticipate that this plan is going to allow jurisdictions or perhaps regions, rural areas of Maryland to move more quickly through the phases than other areas of Maryland?
I know that that's one of the things that we've discussed already with our current coronavirus team, and one of the things that we're going to continue to discuss. We've discussed it with both local government. We have weekly calls with our local government partners. We've had discussions with legislators, and we've talked about it with our team of scientists and doctors, and we'll be making those decisions as we move forward into phase 1. But it is certainly one of the things that we're going to consider, and it's one of the things that I think is possible, but we want to also do that in a safe way.
Governor, the unemployment website portal crashed this morning. It's been a frustration of a lot of people trying to file for unemployment. What are you doing to make sure that that gets fixed? And what do you say to those people who simply just can't get online to file for their claim?
Well, first of all, I'm one of the people that's very frustrated, so I share their frustration, and I'm sorry people had difficulties with that. It is now fixed, and I'm happy about that. We were one of the first states in America to be able to handle this and launch this online. First of all, I had a call with the Vice President just before this meeting. I thank the President for signing into law today the Paycheck Protection Plan, phase 3.5. We're happy to get that funding out so we can help folks. We're happy that they changed the law so we can now get funding out for the first time to 1099 people and to gig workers and folks that were not W-2 employees. They never were able to get unemployment insurance before. And so part of the problem was the normal labor website didn't have the ability to fill out these things online, and we had 40,000 calls backing up into the call center. It was hard to do that. So we developed a brand new website with a vendor. We're one of the first states in America to do that. We launched that this morning at 7 a.m. and it crashed from 7 a.m. for about an hour because of the huge volume. They fixed that within an hour. There were 35,000 people logged on there to do different things today. 15,000 new claims have been processed, which is, it's unfortunate there's that many people, but I'm glad that 15,000 people have been able to process their claims today, and that 35,000 people have been able to access this new website that most people in the country are still waiting on a phone call from most states. But I'm very frustrated that the vendor did not have it ready for the volume. We've expressed that frustration to this outside vendor that developed the website. They put, I think, 100 people on it this morning to try to get it fixed. They did get it back up online. I think there are a couple of glitches still throughout the day, but it's performing much better, and we're going to hold their feet to the fire to make sure they get all the glitches worked out. But we're happy we launched the site, and I'm frustrated that it didn't go off perfectly.
Governor Hogan, the NGA roadmap, which was...
All right, we're back in the studio. I want to thank you if you were joining us today as we were watching Governor Hogan's press conference on Maryland Strong, the roadmap to recovery. Mandy and I are in the studio today, and we're going to just run through everything that he kind of said, because a lot of people may have joined in late, or maybe you just didn't catch it the first time. So this is all of us going over it again. So I think the biggest thing, Mandy, is that there's no date.
There's no date. There's no guarantee. I think he's really leaving it up to everybody.
Yes.
Keep doing what you're doing to keep our numbers low. If we as citizens can keep the numbers low, then he's willing to start, stages. I
Right.
mean, he has a game plan.
He does. He has a game plan, and he did say there was 2 numbers that he really wants to watch.
Yes.
It's hospitalizations and it's the amount of ICU beds that are available.
Yes.
So if we can get those numbers down, because right now they talked many times about the numbers plateaued. Like I know Maryland saw over 800 2 days in a row, but we're not going over that 1,000 number.
Right.
So now we need that 800 number in Maryland to go down to 500, 400, and it'll slowly go. And to do that, I mean, like you said, people just need to keep social distancing. We're doing good. We're doing what they
Wear
want.
a cloth mask and social distance. I
Right.
mean,
So let's talk about his plan. So he talked about 3 big steps.
yeah, it's stages. Yeah.
So there's 3 stages. There's no dates. However, he did say he hopes it's early May.
Yeah, and that's it. If people listen, it goes back to that team thing. Let's work together as a team. Let's work together as a state. Let's come together, do what he's asking.
Right.
We do what he says. He's willing to help us and do, what he can.
Yeah, that's right. So right here, we're going to see the 4 building blocks of recovery. I have it on the screen with me. We'll walk through them real quick. He wanted expanded testing, which we're getting thanks to his joint efforts with South Korea and the 500,000 testing kits that they brought over, and more to come.
Yeah.
He wants to continue to monitor the hospital surge, which we just talked about with the beds in ICU. More progress on PPE, and the Secretary of Commerce actually talked about that, and the more manufacturing that they're getting people to build stuff, and it's just more equipment that we need in Maryland. And then the launch of COVID Link, which is going to monitor tracking, it's going to monitor testing and tracing for Maryland. And if we can get control of all these things, then we're going to enter stage 1. So do you want to go through stage 1 with us?
Yeah, so I had a couple of things I took off. At stage 1, if, that was his key word, if we hadn't spiked our numbers, stage 1, he was willing to open up lower risk attractions, so like things that are, lower risk to people, activities, outdoors. Outdoors was a big key thing if you listened. He kept repeating outdoors.
Yeah, outdoor gym, outdoor
Yes.
church, golf.
Golf, tennis, outdoors, so where you're definitely social distance from people or able to social distance and you're not confined in an area.
Right. And I think what a lot of people that are probably watching at home are also wanting to hear was it's small businesses are in stage 1.
Yeah, and lowercase counties
Yes.
he's willing to work with.
Yeah, it'll be case by case.
Yep.
Local government will control parks, libraries, and stuff like that.
And then he was willing to look at, in that stage 1, I did hear him say people that were needing more same-day surgery type.
Yeah, elective surgeries
Yes.
and all that.
Yeah,
Yep.
he was
that would
willing
be
to
part
work
of
at
it.
that.
Yeah. And so if all that continues to go, I would imagine we would need to do that for a couple of weeks. I don't know.
That's what I'm thinking, yeah.
And then we would go into stage 2. So what did stage 2 look like?
So he had some of the larger, he used that word very loosely, but larger businesses to start opening, workers to return, limited churches, so it would probably go on like the size of your church, or maybe limit it to amount of people that could get in church.
Yeah, I wonder if it would go back up to that 100 number
Yeah,
that we were at
like,
before.
maybe you can only have, say you live in a smaller town, you have a smaller church, well, maybe you can normally seat 100, well, you'd only be able to seat 50 for church, or comfortably, where
Right.
people are more comfortable.
Yeah,
on
I'm sure there'll be a
comfortable
number
level.
somewhere whenever they go to that.
And he was inquiring, raising that number, that was the other thing,
Yep.
of social gatherings, raising that number, looking at, bars, smaller bars, if they were able to open, and smaller facilities, maybe movies and things like that, where they're able to spread out. And that social distancing, that's that big thing, social distancing can be put into place.
Yeah, because Stage 2 also had normal public transit.
Yeah.
So obviously that's, people will be able to be around each other,
Yeah.
but we still need to be careful if we do get to Stage 2. And then, I would guess, after a week or two of Stage 2, maybe we could finally hit Stage 3.
Which is the highest risk.
Yeah, there's no dates. We're just saying maybe. We don't know. It could be months.
Yeah.
It could,
And we don't
I
want to
know.
rush it. I
Yeah,
mean,
exactly. And we don't want to pretend like we know a date because they didn't know a date.
right.
But if we do get to Stage 3, after we've showed that we could do all that, what's in that, Mandy?
So that's going to entitle like your definitely larger outdoor events, larger events. The big thing for us in the county is our fairs, things like that. That's going to be in that stage. Concerts. He mentioned nursing homes.
Yep.
That's
be
a-
able to visit the sick in nursing
Yes,
homes.
that's a
Yep.
big thing, but they're definitely high risk, so that's a, definitely a stage 3. And he kept saying the key is to follow the guidelines through each stage as we go, follow the steps each way, and, the more we follow the steps, the better off we're going to be.
Yeah, and the quicker we go, the more risk that we actually return right back to where we started.
Yes.
Yep. So he did say a couple things in there I want to point out. He did, I know a lot of the time when we were first starting out, it was Corona response team. And he had pushed that, and that we had a response team that had to go in, and that was at hospitals, it was for businesses, it was
Yeah.
everywhere. And they looked at the state as a whole. We're now switching to Corona recovery team.
Yeah, I saw that. They've switched
Which
them.
is a good sign. So, and that team is actually going to be the one that look at and they make real-time decisions based on everything we're doing.
Yeah, and he had pulled, I made some notes. He pulled from the people that have made up that team are several members of many different things in the community. Businesses, churches, nonprofits, small business owners, large business owners. So he didn't just go to one area and was very specific. He gathered a group of everyone. So that was kind of good, yeah.
And I think his final warning was probably the one that people need to hear, is that this isn't going to be over.
Yes, that was,
We need a vaccine. And until then, we always have to be conscious of social distancing.
yep.
If you are in the older population, continue to stay home.
Yeah, he did mention that.
And,
Stay
yeah.
safe, stay home.
Yeah.
And he had some couple key things. His big thing was, as a governor, he wants to keep us safe, get us back to work, open small businesses, and get the economy back on track. That was like his,
Yeah.
game plan. That was his big thing. He's trying his best. And I like his ending out. He said, together as a state, we will return stronger and better than ever. So, he's on the track. He sees the light at the tunnel. He just has to work to get there.
That's right. And it was about where he had ended his section. And I think that's maybe where we'll end our show today. If you have any more questions, throw them in the comments. We'll try to answer them for you. Or we'll try to point you into resources like the governor's page, where he actually has all of his steps listed. But we want to thank you for watching the governor's press conference with us. Thank you, Mandy, for joining me today as we recapped. And a special thanks to Chris and Ted, who are in the booth, who had to sit through a very long time. So thank you guys for joining us. Thank you for watching, and we'll see you next time.